My name is Joanne Moore. I'm a physical therapist, and I've designed this exercise program to help caregivers gain the strength and endurance to meet the demands of caregiving more easily. Caregivers who are fit report less stress, better sleep, and a greater sense of joy and well-being. Just as the flight attendant instructs us to don our own oxygen mask before helping the person next to us, caregivers also need to take care of themselves before they're strong enough to help their loved one. So caregivers, eat right, get plenty of rest, and exercise daily. Stretches should be performed when your muscle is warm. You can warm the muscle either by applying a heating pad or taking a shower, or simply by being active in getting the muscle warmed up through activity. Perform each stretch until you feel a gentle pull on the muscle, and then hold that position for 30 seconds. Repeat the exercise between 5 and 10 times, once a day. You shouldn't feel any soreness really during the exercise or after, but if you find that you develop soreness, discontinue the exercise for the rest of the day and apply ice for 10 minutes. You can resume exercise again the next day, just be a little bit more gentle. The first exercise is neck rotation. Slowly turn your head toward the left, looking over your shoulder. Hold for a few seconds. Return your head to a neutral position. And now turn your head to the right. Hold it there for a few seconds. You should feel the muscles gently stretching in your neck. Repeat this exercise 5 to 10 times. The shoulder roll. Stand, draw your shoulders up towards your ears, then back and down. And repeat, drawing your shoulders up towards your ears, then back and down. Repeat this 5 to 10 times. Side bending. Slowly tilt your head, hold it there for 3 to 5 seconds, feeling a gentle stretch on the right side of your neck. Bring your head gradually to an upright position, and now repeat, hold it 3 to 5 seconds, feeling a gentle stretch on the left side of your neck this time. Then return the head to the upright position. The next exercise is the chin tuck. This is very helpful for treating headaches or for general tension. This exercise can be done sitting or standing. Start with your head in a neutral position and then draw your head straight back, not looking up, but just straight back, creating a little double chin for yourself. Hold it for 3 to 5 seconds and then relax. This exercise is to stretch the hip muscle, which sometimes gets stiff when you sit for a long period of time. Take the right ankle and cross it over your left knee. Place your right hand on the inside of your right knee and gently press it down, stretching the inside of your hip. When it starts to feel tight, hold it there for 3 to 5 seconds and then ease up. Repeat this exercise 10 times or until the hip feels nice and loose. The next exercise is a heel cord stretch that you've seen runners do. Stand holding onto a piece of furniture or a wall for balance. Step one foot in front of the other. Keep the back foot flat on the floor, toes pointing straight forward. Allow the front knee to bend and shift your weight so that you're standing primarily on the front foot. You should feel a stretch in the calf muscle on the rear foot. Hold this position for 10 seconds and repeat it 3 times on each leg. The next stretch is a hamstring stretch, and doing this will help to prevent a low back injury when lifting. Stand with one foot up on a stool or the first stair in a staircase. Hold onto a banister or the wall for balance if desired. Keep that knee straight and reach your hand forward as if you're trying to touch your toe. It's not important if you can touch your toe, but reach forward in that direction until you feel a gentle stretch on the back of your hamstring muscle, in the back of your thigh. Once you feel a little stretch, hold it there for 30 seconds and then relax and repeat the exercise on the other leg. This exercise needs to be done only once on each leg for 30 seconds each time. The next exercises are done in a standing position. This one is for your low back. Stand with your feet comfortably apart, hands on your hips, and keeping your head in a neutral position, press the pelvis forward so that you're bending backwards slightly at the waist. Don't hold this position for too long, just come right back upright and then repeat 10 times. Remember not to look up at the ceiling, keep your head in a neutral position, just bending that low back backwards. The next exercise is also for the hip, and this exercise will help that stiffness that sometimes we feel when we rise from sitting after a period of time. The exercise is done standing. Hold on for balance if desired. Come up onto the ball of one foot and pivot the heel in and out in a rotary motion. Repeat 5 to 10 times. And then continue the exercise with the other foot. When you finish with the flexibility exercises, your muscles shouldn't feel sore at all. They should feel relaxed and comfortable.